Hello, I'm Dr. Fiona. Eye emergencies are very common at home and in the workplace. In this video, I will teach you the correct steps of how to help a person if they have an eye emergency. The first eye emergency we'll be talking about is red or irritated eyes. Imagine if someone is walking along and suddenly they have dust enter their eyes. Now what do? The first thing you can remember is do not rub the eyes or blow into the eyes. When we rub the eyes, we actually press whatever dirty particles deeper into the eye. Also, if we rub too hard, we may actually scratch the front part of the eye, leading to something called corneal abrasions. Do not blow into the eye of the patient because this will introduce saliva or germs into the eye and further worsen the condition. What you can do is take a torchlight or use the light from your phone to check the patient's eye. If you can see any visible dirty particles or suspect dust has entered the eye, you can use tap water, sterile normal saline or artificial tear lubricants to wash the eye. After washing the dirty particles out, please use artificial tear lubricants 1 day 4 times. However, if there's persistent redness or eye pain, please go to the nearest eye doctor for further treatment. The second eye emergency is chemical injury or chemical splashing into the eye. Now, chemical injury is one of the true eye emergencies as every second counts. If chemical suddenly splashes into the eye, the first thing you do is run to the nearest tap and wash the eye for at least 30 minutes. This will wash out any offending chemical and hopefully minimize injury to the eye. Also remember to wash the face as you don't want the chemical to burn the face. After you finish washing the eyes and face, you can remove the contact lens if you're a contact lens wearer. Then, wear sunglasses and go to the nearest eye doctor for further treatment. Please remember to bring along the bottle of chemical which splashed into the eye so the eye doctor will be able to know which treatment will be the best for you. The last eye emergency is trauma to the eye. Sometimes when we fall down or things hit our eyes, we may sustain trauma to the eyes. Most importantly again is do not rub the eyes. What you can do for the patient is this. If there's active bleeding, use clean tissue or a clean cloth to stop the bleeding. Ask the patient to see if they can open their eyes. If they're able to open the injured eye without pain, ask them to close the good eye with one hand and see if the vision in the injured eye is affected. Then use a torchlight or light from your phone to check for any external eye injury. Afterwards, protect the eyes with sunglasses and see an eye doctor for further treatment. If you don't have sunglasses, don't worry. Just take a paper cup and use cellophane tape to tape the cup over the patient's injured eye. It's important not to bandage, pat, or place pressure on the eye as this may worsen the eye injury. This concludes our video for today. And if you've enjoyed it, please remember to like, subscribe, and share. Thank you.